Skill number 4. Assists with the use of a bedpan. The supplies that we will need for this skill is 2 pairs of gloves, 1 bedpan, wipes, toilet paper, and an imaginary privacy blanket. Knock, knock. Good morning, Mr. Smith. My name is Chris. I'm going to be your nursing assistant today, and I'm here to assist you with the use of your bedpan. Is now a good time? I start off by washing my hands, confirming the identity of the patient with the wristband, providing privacy, and gathering my supplies. I'll go ahead and check that the wheels are locked, and I'll raise the bed up to my waist level. Now there are 2 methods that I want to focus on for this particular skill. The first way is to turn the patient to the side to place the bedpan. The second way will be to bridge the hips. Both ways are correct and none are wrong. It's more of a matter of personal preference. However, if you are going to turn the patient to the side, the opposite side guardrail will have to be up. So I'll do that now. Before touching my patient, I'll make sure that I don on clean gloves. Next, I will place my imaginary privacy blanket over the patient, spreading it, not shaking it, to serve for privacy. Mr. Smith, can you please hang on to your privacy blanket as I pull down your clean sheet? From here, I will move the opposite arm out of the way, straight up. The closer arm will go across the chest, and the closer knee can either be flexed or it can be crossed over the other. That's more a matter of personal preference. Mr. Smith, can you please scoot towards me a little bit so you're in the center of the bed when I turn you? On the count of 3, we're going to turn towards the guardrail. Please reach for it. Are you ready? 1, 2, 3. Next, I will expose the area that I'm working with before placing my bedpan. Next, I will use the wider side of the bedpan and place it against the buttocks before turning the patient back towards me. Mr. Smith, on the count of 3, please turn back towards me. Are you ready? 1, 2, 3. Making sure that the patient is sitting on the bedpan with proper placement. Now remember, there is a privacy blanket here, although your proctor will have to confirm the placement of the bedpan. When you elevate the head of the bed, we also need to focus on readjusting them onto their bedpan because it is going to shift. You want to confirm placement before you leave the room. At this time, I will go ahead and lower the bed to its lowest level before elevating the patient into a semi-seated position known as the Fowler's position, which is about 45 to 60 degrees. At this point, I will readjust my patient for placement, making sure that they are sitting flush on their bedpan. Now, because we do need to leave the patient alone in a seated up position, we're going to go ahead and elevate the head of the bed guardrail on the working side as well. We're going to go ahead and put wipes and toilet paper within the patient's reach. And we're also going to put the call light within the patient's reach. Mr. Smith, I'm going to go ahead and leave the room now. When you're done, please signal me with your call light so I know to come back in and assist you. At this time, I will doff my gloves, throw them away in the trash, wash my hands, and leave the room. When the patient signals that he's ready, we're going to knock, reintroduce ourselves. Mr. Smith, my name is Chris. I'm your nursing assistant, and I'm here to help you get off of your bedpan now. Is now a good time? Patient states yes. We can go ahead and wash our hands, put on our second pair of gloves at this time. Now, when placing and removing the bedpan, it's important for us to focus on making sure that the client is supine or flat in bed. So let's go ahead and lower the head of the bed. Lower the working side guardrail. Let's take the wipes and toilet paper and put them away in their designated area. Next, I will raise the bed up to my waist level again so that I can remove the bedpan. From here, we're going to follow the same procedure that we did to put them on the bedpan, which is to move the opposite arm out of the way. Closer arm goes over the chest, and flexing the closer knee. Mr. Smith, on the count of 3, we're going to turn you towards that guardrail. Are you ready? 1, 2, 3. Moving the patient out of the way. We're going to go ahead and remove the bedpan and adjust the patient back to comfort onto their back slowly. Straightening them out. Now from here, for testing purposes, we have to discard our station first prior to lowering the bed or touching anything else that would be clean at this time. The last thing we're going to be touching with our dirty, contaminated gloves is going to be the dirty privacy blanket. At this time, I will empty, rinse, and dry my basin and place this into the dirty supply area. My wipes and toilet paper have already gone back to their designated area. These have already gone to the trash. And my towel will be discarded into dirty linen. From here, I will remove the dirty privacy blanket and dispose of it into the dirty linen container. Next, I will doff my gloves, throw them away in the trash, and wash my hands. Return to my patient with clean hands, cover them back up with their clean sheet. Hand the patient their call light directly in their hand. Mr. Smith, if you need anything after I leave the room, please let me know. I will lower the bed down to its lowest level for safety. I will confirm that the wheels have remained locked. I'm going to remove the privacy, wash my hands, report and document, and then my skill would be complete. At this time, I would like to demonstrate how to have the patient bridge their hips should you want to do the other method, and how to place your patient on their bedpan and how to remove the bedpan. So we're going to confirm that the patient is supine in bed, the bed is at waist level, they have an imaginary privacy blanket, and their clean sheet is down. At this time, we should move the gown out of the way so that the patient does not sit on it. We should make sure that the wider side of the bedpan is towards the buttocks, and then ask the patient to bridge their hips. The participant will then have to use one hand to lift the hips of the mannequin at this time. Mr. Smith, on the count of 3, please bridge your hips so I can place your bedpan under you. Are you ready? 1, 2, 3. Like so. Confirming proper placement. Now we'll go ahead and finish our procedure so that we can leave the room. Hand the patient their wipes and their toilet paper within their reach. Make sure the patient has their call light. Remember, there's an imaginary privacy blanket here. We're going to go ahead and lower the bed to the lowest level for safety first, before elevating the head of the bed and activating the closer side guardrail. From here, I'll readjust the patient to proper placement. I'll go ahead and activate the closer side guardrail. The patient already has his call light. Privacy has already been enacted. At this time, I will doff my gloves, throw them away in the trash, wash my hands, and leave the room. When the patient is done, we're going to go ahead and knock, reintroduce ourselves to our patient. Mr. Smith, it's Chris, your nursing assistant. Are you all done with your bedpan now? Excellent. I will begin by washing my hands and donning on my clean second pair of gloves. I will start off by lowering the head of the bed. The patient must be supine when removing the bedpan as well. Elevating the head of the bed itself, to waist level for proper body mechanics. I'll take the wipes and the toilet paper and put them in their designated area. And I'll lower the working side guardrail. Now the patient is supine, so we're ready to go ahead and have the patient bridge their hips again. Mr. Smith, on the count of 3, I want you to bridge your hips so I can remove your bedpan. Are you ready? 1, 2, 3. From here, I will go ahead and empty, rinse, and dry my bedpan and place it in dirty supply. Now for testing purposes, we will imagine or pretend that there is a toilet or a bathroom adjacent to the room. It's not as if we're turning our back on our patient when the head or the bed itself is elevated. This is simply for testing purposes. So my bedpan has been put in dirty supply. I've already said that my wipes and toilet paper have gone to their designated area. I'll go ahead and take my dirty towel and toss it away into the dirty linen container. Last thing that we're going to touch with our contaminated gloves is going to be the dirty privacy blanket. I will remove the dirty privacy blanket and throw it away into the dirty linen container. I will doff my gloves, throw them away in the trash, and wash my hands. At this time, I will do my outro, covering the patient back up with the clean sheet. Making sure the patient has his call light within his reach. Mr. Smith, if you need anything after I leave the room, please let me know by hitting your call light button. I will lower the bed to its lowest level. I will check one last time that the wheels have remained locked. I'll remove the privacy, wash my hands, report and document, and then my skill would be complete.